Thank you. Welcome, everybody. Good afternoon. Thank you so much for taking out your Tuesday afternoons for us to learn a little bit more about the WomenLift Health journey. We are truly, truly honored to be here in the midst of our alumni and very excited to kick off this conversation on the WomenLift Health journey. As some of you may know, WomenLift Health has launched its applications for the 2025 India Leadership Journey last month. Many of you on the call hopefully have already kind of started their applications or in the midst of it or have received some sort of notification for it. This is our signature program that aims to provide mid-career women like yourselves in health with tools and strategies to enhance their voice, leadership presence, and influence. And throughout the journey, these women are supported with a powerful group of peers, mentors, and coaches. This particular session has been curated for all of you to gain firsthand experiences on what is it that the women go through when they're part of this journey, what are some of their challenges, what are some of their wins as women leaders in health, and to give you a glimpse about the application process. So thank you again for being here. And before we kick it off, I do want to acknowledge some team members who are in the room. We have Prachi, who's a senior program manager here. We have Sanaya, who's a senior strategic comms senior coordinator. We have Gaithan, who's helping us with the tech. So thanks, Gaithan, for being here, not in our time zone. And Purbi and Andhra, who are program coordinators. Before we start, I just want to keep some housekeeping rules up front, just so that you know how we're hoping to conduct this live Q&A. This live Q&A will be split into two sections. There's going to be a moderated discussion between me and the alumni who you can see, and I will introduce them in a minute. That will be followed by a live Q&A discussion for about 20 minutes. In the live Q&A, when the moderated discussion is going on, we're going to have both our alumni and staff. So Prachi will be taking questions from the audience about the leadership journey, about any kind of program details, about the application process. The way to do that would be for you to submit your questions by typing out your full name along with the question and direct it to either the alumni, if you're asking a question to an alumni in the Q&A section, or just kind of pose your question on chat again with regard to applications. Your application questions will get responded to on chat. And if you have any questions for the alumni during the Q&A section, between Prachi and I, we're going to be taking notes of the questions that are coming in, and I will be posing it to the alumni. So feel free to kind of keep the chat alive and keep posing your questions as the Q&A session is going on. Just so you know, the session is being recorded for your information. And with that, I'm going to kick it off and introduce our panel. Thank you, Pragyan, Mansharan, and Madhura for being here. I'm going to take a quick minute and introduce all of you. Dr. Pragyan Acharya, 2023 Cohort India Leadership Journey, is an additional professor of biochemistry at AIIMS, New Delhi, whose research interests lie in immunology, in organ dysfunction and innovation of novel diagnostics in liver and kidney diseases. She is a strong advocate for her female students who want to have a career and raise a family at the same time. The work environment in her laboratory is free, flexible, and driven by curiosity and a love for science. Thanks, Pragyan, for being here. We really, really appreciate it.
Thanks,
I want to take a minute and introduce our second panelist, Mansharan. She's a 2023 Cohort India Leadership Journey, currently works with the William J. Clinton Foundation, the India affiliate of CHAI, as Director, Sexual and Reproductive Health, Child Health, and Oxygen Access. Her work spans right across the spectrum from long-term program strategy down to field implementation. She has over 20 years of experience working across both for-profit and the nonprofit space. Thank you, Mansharan. We really appreciate you being here and taking the time.
Thanks.
Great. And last but not the least, we have Madhura. Dr. Madhura Kulkarni is a gold medalist for Masters in Science from the University of Pune and has obtained her PhD in molecular genetics from the University of Maryland, College Park, USA. Her work has been published in many high-impact international journals. Dr. Kulkarni has received a prestigious re-entry Rama Lingaswamy Fellowship from the Department of Biotechnology, India, And since her return to India, she has established a comprehensive tumor biobank. Her research focuses on investigating novel molecular signaling pathways that lead to aggressive breast cancer, specifically in the Indian context. Thank you, Pragyan, Mansharan, and Madhura for being here. We really, really appreciate it. And with that, I'm going to kick off the panel discussion. Again, for the audience members, you may not be seeing yourselves on the screen, but feel free to use the chat as your way of communicating with us. Keep it alive. Just keep posing your questions and be rest assured that one way or another, your question's going to be addressed. Awesome. And with that, I'm going to start off with Madhura. Madhura, you graduated from the journey in 2022, which was our inaugural cohort. And as a senior public health professional, what have been some of the consistent challenges you have had to face at the workplace? And how has the journey, the leadership journey, helped you in navigating some of these challenges 2 years after the leadership journey?
Yeah, thank you, Avantika, for the introduction and for a very thoughtful question as well. It's been 2 years since I graduated, and what has changed before and after journey is mainly my awareness, how I look at things, and how I operate with more intention and awareness. So that's a major shift for me through the journey, mostly because of the interactions, not only with peers, those were quite fundamental. Every day, every week, we used to meet up online. So our cohort was 100% online at that time because it was during cohort time, COVID time. But the mentors that we had and the in-depth interactions that we had with the mentors, that has definitely helped shift my angle, the way I operate. And the major take home, I would say, which was important for me, so in our worlds growing up, we are told that the professionalism and emotional worlds are separate. Emotions are your personal life, and professional world, you're going to be more practical and professional. It was a eye-opening discussion for me when emotional intelligence was brought in the discussion during one mentorship session. And the fundamentals were, you don't want to keep the emotional intelligence away. So now there's a difference between emotions and emotional intelligence. In intelligence, you're aware of yours and the emotions of the other person you're interacting with. You're accounting for those. At the same time, you're maneuvering in a professional setting. So that was a eye opener, and also it made things much easy for me in operations. The burden to keep emotions away was taken away, and how to handle them, manage them in a work environment, and incorporate them in making decisions, making the other person comfortable, and getting things done. So it was a major shift, and that's the major takeaway so far. And I mean, as a result, it incorporated the authenticity for me, because trying to keep the emotions away, mine and other person's both, was kind of taking the authenticity away. So that things were much easier when two things came together. So that's the major take home I would like to put out here.
Thank you, Madhura. Thank you for sharing that. And I think one of the big things we focus as part of the leadership journey is this ability to be authentic as a leader as you come into the workplace. And to be that, I think the women go through multiple things, but one of the things that they go through is something called psychometric assessments, where they're given a series of assessments to try and understand themselves better, and also how they're viewed as leaders better. And I think in the sessions that at least I've sat in, I have seen how the women have responded to some of these things, hearing some of this feedback or hearing some of this analysis for the first time, and being a little bit blown by it. And the room sees all kinds of emotions when this happens. So I'm glad that that was a big takeaway for you from the leadership journey. And I hope that other women are able to benefit from this as well. So thank you for that, Madhura. Mansharan, over to you. You are our newer alumni from last year, and you already occupied positions of leadership as part of your work with CHAI, but also other organizations before joining the journey. What has been the transformative impact of the WomenLift Health journey for you? And I'd also be kind of curious to learn a little bit about what are some of the changes that you have witnessed in teams that you have managed as a woman leader, and how has the journey supported you in that, if at all?
I think I'd start by saying that, and echoing some of what Madhura said, that for me, the start point was also about the journey of self-discovery, right? Starting with the 360 assessments, which I think the last time I done was 15 years ago, before the cohort, at a very early part of the career, and then there was this huge 15-year gap. So I think that discovery and the considered pause to say that, focus on a level of self-awareness on who are you, what you want to stand for, and being very, very considered about building that into what do I want to be known as a leader, right? Now, I work in an area which is a fairly sensitive area, sexual reproductive health, right from the get-go, whether it's strategy, implementation. So there is, a certain sensitivity which comes around that work area itself. And I think what has really, really helped me with is to say that what is that brand, the brand of authenticity that I first want to build. Who do I want to be known for? Now, whether it means tomorrow actually saying no to a program. So I think it's two ways, right? I have at least tried to be mindful of it, not just, let's say, in people management, and I'll just come to that, but one is also in programs and the work that you want to do, other things that one can say no to. Do I have to say yes to every responsibility that comes my way if I don't really honestly believe in it, just another project or program to have one. So I think the second part has been, which I think more, even more joyous, has been about bringing in that inclusivity on two prongs. Again, one from the program design point of view, that everything that we do now, whether it's about vaccine access or child health or infant mortality, is there the inclusivity lens that comes in, and a sense of leadership. Now, whether it is a Panchayati Raj institution, that leadership doesn't rest within this cohort in the Zoom call, but it rests in every singular woman who works in public health. So for me, that's been one major learning that, like, to actually be able to build into the programs. And the second is, like, I manage a fairly large team, and somewhere it's 20 plus. A lot of them are women. Let's say in the 6 to 7 to 8 years of work experience. So how does, I think for me, then that effort has also been about bringing in a sense of inclusivity and actually being considered about how am I developing them as leaders. Now, some of them may go on to be a part of the journey, some may not, but how am I, in a very considered way, in a very self-aware way, still, doing something and spending some percentage, like I try to tell myself it's 5% of my time, but is it really doing something once a week that, that how are you building people? So for me, that's been the big learning, to be able to be really considered about it, and to take it to program, and actually to take it to public health programming, and secondly, to take it to teams.
Thank you, Mansharan. Thanks so much. In some of the work that we do, I think our aim as WomenLift Health, even as part of our theory of change, is to get the people that are part of this program to act with intention. And I think that that's kind of what I'm hearing from you, Mansharan, is that perhaps some of the things that you knew of, were aware of as a leader prior to this, through this journey and through this program, doing it more intentionally as a team leader, being inclusive more intentionally, right? And taking out that time to be able to do that, I think, with the people that you work with in the organizations that you work in. So thank you for sharing that. I think that's a very, very useful insight. Again, just plugging in for the folks who are listening in. If you have any questions for the panelists, just put them in on the chat and we will try and respond to it. Pragyan, over to you. I'm going to shift gears and talk a little bit about your leadership project. For those of you who don't know what leadership projects are, it's a big part of the leadership journey. We ask the women to work on a passion project that they would typically have thought of, but not had the time or the bandwidth to kind of work with. And through this one-year journey, you don't just get the opportunity to work on the passion project, you also get the support of peers, mentors, coaches who can support you in building this passion project. And I think Pragyan had a very fascinating leadership project, which focused on understanding how pain is perceived differently by female patients, particularly of chronic and autoimmune diseases. And to that extent, Pragyan, would love to know what made you think of this issue in the first place, and how did the leadership journey compel you to work on this problem, and talk a little bit about what you were able to do with the project.
So thanks for the question, Avantika. So to be very honest, it was my first experience putting a lens of gender in any project that I was doing. So I'm very grateful to the leadership journey and the project that I wrote, because before this, I'm a trained molecular and cell biologist. And what I work with are proteins and biomolecules and DNA and RNA and things like that. Never in my entire training have we ever considered gender as a potential, factor that can impact the outcomes of what we are looking at. Although it's very much there at all times, and we all know that if we use cells derived from women, they will have 2 X chromosomes. And if we use cells derived from men, we are going to have 1 X and 1 Y chromosome, which can influence how your study outcomes can be. Same thing in all kinds of studies using rodent models. So a lot of what I do is what we classify as molecular and cellular medicine. So discovery of drugs, discovery of novel diagnostic tests, discovery of any kind of biological discovery, trial outcomes, outcomes of clinical trials, all include the angle of gender, but at the molecular and cellular level, we do not use it as a factor. So we'll either design experiments where all the mice are male, very well knowing that if we have a mix of both, it may actually not give us very impactful outcomes because gender will have an impact. So we don't test it in both models. We just do all male or all female, just to make our lives easier. Now, the reason I thought about it is because if I have to write a leadership project, I cannot suddenly become a public health person. My training and my entire work focuses around molecular and cellular medicine. So how can I include this aspect into my own research work? When I started reading about it, I discovered that there's this whole area called gender medicine, wherein there's a huge number of studies which include these areas of pain perception and autoimmune disease, which have been investigated very thoroughly. So it's very well established in animal models that male and female animals perceive pain differently. They may have the same kind of pain receptors, which is what you need to perceive pain. But the level at which these pain receptors are expressed in male and female animals are different. The type of pain receptors are different. Similarly, everybody knows, it's a well-established fact that women are more susceptible to autoimmune diseases as compared to men. Right? So why is that? So that's an area of gender medicine. So that is what brought me to this area. And although I started with working with pain perception, but it was a little bit out of my immediate zone. So we have decided to take it up as a long-term project. But within my immediate sphere of looking at diagnostics, because we do a lot of innovations in diagnostics, what I did is I took the most common and famous emerging biomarkers of renal and liver dysfunction and just stratified it by gender. And it was very clear that many of these markers, which may become future diagnostics, are expressed at very low levels. They're undetectable in women. So you will almost have a situation where you'll have a bunch of, if any of you watch that movie Lapata Ladies, where you're missing out all these ladies with a particular syndrome because their diagnostics, the markers that you are looking for, they are not present or expressed at high levels in those women. So right now, I think I've turned that gender medicine perspective into a new area in my lab, where we are looking at whatever innovations in diagnostics we are making, how does gender impact that? So that is a little bit about my project.
Thanks so much, Pragyan. And I think we've been hearing quite a bit about what does it mean, or this field of work, right, that's picking up about gender disaggregated data and using that particularly in medicine. We've had quite a few people in our cohorts who are working on this, and we're hoping something comes out of it because, like you said, the model for some of these things are often male and not female. And so the symptoms that we're learning are about men. And we miss out on what does it mean when women experience things differently. So thanks for that. Mansharan, I'm seeing a whole bunch of questions on the leadership project. I know that you also had a project on expanding contraceptive choices for women exploring the idea of an on-demand contraceptive pill, which was a really, really interesting project. And I know that we spoke about that a little bit, but maybe for the sake of the audience, since there's so many questions coming up on it, maybe you can walk us through what made you consider this option. Some folks are asking, what do you keep in mind when you choose your projects? Any tips to keep in mind? And what could be the horizons when you opt for something like this? So just maybe on that theme, if you can reflect a little bit on your project, that'll be great.
Sure. So yeah, I'll just give a little bit of context about the project. And like I mentioned earlier, so work as director of the sexual reproductive health portfolio here, and part of our mandate is also to look for, look at existing health systems and, how do we have efficient deployment of existing contraceptives. But what is something for which there's, let's say, little utilization of time and effort is what should be the new thinking in this area, right? So so in that piece of newer thinking, and this is just something to think about, that let's say in my work, I found that maybe 90% of the effort was about saying existing public health systems and how do we deploy the family planning program better. But somewhere, maybe 10% of me wanted to spend time on saying, yes, this is fine, but can we look at contraceptives completely from a new lens? The country's demographic is changing. There's 250 million adolescents. Our population profile is very different today from what it was 50 years ago. And are we actually looking at contraception always from a public health lens, but never from a person's lens? So for me, the exploration and the opportunity of the project was also to say that what is it that I'm not getting time for during the whole bread and butter, of running the program? And is there there's a topic that I want to really dive deep into, which I'm really not getting to do, which still sort of fits somewhere within the work area of what I'm doing today? And can I use that as an opportunity to really push the boundaries and maybe spend some percentage of my time on that? And in the end, it is also tied together. So yes, somewhere it fits into my organizational objectives. May not be a project today, but something that can be developed into a new area. That's one way one could think about it. And the second lens is also sort of a practical lens, I would say, for everybody, that, do you have, without making it so expansive that, of course, whether there are financial resources and research, etc. So I think what is let's say, more in terms of resources, not just people resources, but like financial resources behind it. So something that's lean. Third, what are the networks within this entire cohort that you could actually leverage towards that project? And sometimes for me, there are lots of people in my cohort, and I actually use as stakeholders, because the whole idea that I landed on was then to say that there is this young cohort, there is a younger population who may not be sexually active today. They may not be married. The whole dialogue of family planning or contraception in our country is about, married population, you get married and here's a pill. But what about the rest of the people who might still be sexually active, but not in one long-term relationship? And so we found that there was a lot of cohorts of people, young people, even older people, where frequency of sex was becoming like a huge determinant to say that I don't want a daily method, I don't want a daily pill, I don't want something that I have to consume every day. But yes, maybe I meet my partner once in 4 months, 5 months, 6 months. And what do you have a contraceptive that can help solve for me? So this was such an interesting area, but of course it was not sitting within, like, let's say, contraceptive deployment today, but maybe it's an idea that 4 or 5 years down the line can have huge, somewhere it'll lead to an actual product. So the idea that I had was to do foundational work and actually do a sort of dipstick into, let's say, how do we test this idea with a small cohort of people, but very relevant people who were either stakeholders, they were doctors, public sector or private sector, or those who work in public health. So I chose the scope to say that prima facie, how do we assess whether there is merit? Like if, let's say, one had to do round one assessment of saying if something has to work into or develop as a commercial idea, what is the first proof of concept almost to say that yes, does it, what is the appetite, who does it appeal to, why, what is the need that it will solve? And the next step, and that's what I really fixed as the scope, like I said, kind of like an adjunct to your existing work area. It could also sit very well within the existing area itself. But for me, it was a little bit of an adjacency which I wanted to find the time for, but could not find the resources for. And certainly look at what's the power of this network, the power of the cohort that you can leverage. Is it something that you can use to communicate to your larger, let's say, ecosystem for, and your external stakeholders? What are the relationships or some networks that it may help you form, or connections that it may help you form? And thirdly, just from a practical doability lens, do you have the resources and the time to do it? So I'll pause here.
Thank you, Mansharan, and that answers the question really beautifully, because that was really the intent of the leadership project is, and just to even answer some of the questions that are coming in, the intent of the project is for it to be in the area of work that you can influence. So make sure that you have enough of the wherewithal to be able to influence that issue area or the problem that you want to touch, but let it also push you a little bit, right? So it's meant to be a bit of a stretch goal. Don't just implement a project that you're doing at the workplace. While it has to be at the intersection of public health and gender, let it also be a stretch goal that you're hoping to achieve through this project. Yes, Madhura, I saw a bit of
I
a...
want to add into the leadership journey. So ours was the inaugural cohort. We did not have so much like inputs out there, like what should be the project and what are the criterias. And I literally took it as leadership project journey. So my leadership project was, I am a part of a scientific committee for or a consortium all over India, Indian Cancer Genome Atlas. And I'm the only female, young female. The rest are all close to retirement or post-retirement male people sitting on the scientific committee. So my project was how to navigate the leadership, the scientific committee as a leader in the setting, and how can I voice myself without upsetting people, and how to put across. So it was tied up with my progression as a leader, along with the Cancer Genome Atlas, like approaching across various hospitals across India, bringing people on board to bring in the samples for India-wide genome sequencing project. So although there was a science aspect, I literally tied up the leadership journey into it of mine, into the project, and it worked out very well. It helped both the angles, taking the project forward and taking me forward as a leader in the setting. Yeah, I just wanted to share it with everyone.
Thank you. Thanks so much, Madhura. And since you're speaking, I will ask you to touch a little bit on this aspect that nobody will likely ask, but I want to bring it up is, in your mind, what were some of the practical challenges of being part of the journey with your full-time work, and how did you address them, if at all?
Actually, as I mentioned, ours was the one fully online during COVID time. So all our work was online. So managing spaces was not a problem at that time. Just blocking the time that I'm going to attend 2-hour session and keep all the meetings around that time. So I don't think it was that challenging for us. The times were blocked across the year, so I could maneuver my meetings and stuff around it. So because I was not physically moving around different places, so my job right now, actually I work at 2 different places. I have an academic lab in an institutional setting, and I work with a breast cancer clinic to maintain the biobank. So I do shuttle between the 2 places quite often in a week. But during COVID time, because we were all bound at home, attending WomenLift sessions was not that difficult actually. Yeah. But mine is a unique case. I think you should ask the other 2.
Pragyan, would you want to answer that for someone who attended 2 residential workshops and some virtual sessions? Any constraints that you faced, and how did you overcome them?
First of all, I think most of us really looked forward to the sessions and looked forward to the in-person meetings as well, because it was a chance to connect with all the peers. And I will say that WomenLift Health, the peer group was excellent. I mean, I just feel lucky to have been a part of it. But the challenges were sometimes, the meetings that we had, making it for the meeting, because you also have a full-time job. And even if the meeting's in the evening, sometimes, you're rushing to get your kids' homework done, and, all those things. But we managed, I feel that the human capability is limitless. We manage it. And of course, Avantika's timely phone calls and reminders helped. But I think we shouldn't stress too much about it, because it, often what happens that even in our regular jobs, we get lots of deadlines and things to do, and we manage it. It may not be perfect or as we envisioned it initially, but we get something done. So even if we get that something done and push ourselves in that direction, that is a goal achieved, is what I feel.
I'll just add on one
Yeah,
small that I think the organizational endorsement and support is also it's important. I think if at the start, whoever your organizations or managers, once they're on board that yes, you will make a certain bit of amount of time for this. I think just getting that buy-in at the beginning and their support helps, and to get some colleagues to maybe step in when needed. I mean, that's just the last bit, but I think like Pragyan said, between multiple pieces coming together, I think it can get very well managed.
Thanks. And Mansharan, if I could hold on to that thought, we're getting a bunch of questions around what are some of the things that they should exemplify in their applications. And while, of course, you were not at the receiving end of actually going through the applications and being selected, in your mind, any tips for anyone who's applying in terms of things they should highlight, or just as part of your journey of writing the application, are there things you learned that you'd like to share?
So I would say, I think just one, I mean, just a holistic overview of what your journey has been in the public health domain, just highlighting sort of various areas that you've sort of gained exposure to, and or areas also where you've not had so much experience, and then really about bringing in something new. And so I saw that in one of the questions, it doesn't have to be necessarily a new area of thinking. I don't think it has to be a new area of thinking per se or something outside, but just to bring in a new lens to it. That's what I would say. That look at. I would assume all of us are from public health, but how do we, like Pragyan said in her example, it was just one more layer of gender on something that's an existing piece. Which will maybe make the application really stand out. So it could be an existing issue or an existing topic also, but just a new lens of looking at that topic.
Great. No, thanks, Mansharan. Super
Just
useful.
add
Oh,
to Mansharan
yeah.
said, I think it's important to be authentic in your application. Like there are many questions other than the leadership project as well, which the application asks for. And really, I mean, I think the leadership project is also a kind of I found it very hard to fill that application, which is why I extended it till the last day, because it really needs you to reach out into literally into your soul, right? The questions are designed in such a way that you can't fake it. And you really need to, if you want to benefit from the journey, you need to be very authentic about your experiences. Why do you want to apply here? And what is it that you hope to get from it? And the project should also be something that is of interest to you, not just designed for the application. But if you really had to put that lens of gender, how and where would you put it in your work? So you will need to ask yourself these hard questions and find the answer to it, which is tough, but I think it needs that introspection. That's just what I had to do.
Thanks, Pragyan. And I think if you were sitting on the other side as part of the selection committee, I mean, some of your answers are exactly the kind of things that we look for, right? So thank you so much. I want to end the panel discussion with one question. I'm going to ask all three of you to answer. And maybe Madhura, I can start with you, is what was your big aha moment, takeaway after completing the leadership journey, and how are you paying it forward in your own way?
Yeah, there's one word for it: agency. The word was also new for me, although what it incorporates, I have been doing it in my lab as I run my lab. So most of the people who work in my lab are also females coming into professional world for the first time, aspiring to do a PhD and further research, going abroad. So I have been working with them to achieve their goals. I did not know that it's called agency. So now I do that with intention and knowing that what is happening is agency. And it just extends not just with people who work with me, but the colleagues who I share space with, and giving them push and encouragement also is part of agency. paying it forward. There are many people I recommend to apply to WomenLift just to take it forward. So yeah, the term agency to pay it back and take it forward.
Thanks, Madhura. Pragyan, can we hear your answer?
Yes, I mean, there are so many things, but I think one, as somebody who works in a laboratory or is a more molecular worker, so one of the things that has always kind of a question that has always come up is how do I make my impact felt more? And that is the answer to that is what I got during, the leadership journey, because you know that the design of the journey is such that, you get some inputs, but you also have to introspect a lot. So one, like Madhura summarized it in one word very nicely. So for me, it would be service, science as a service to society. How can I do that? That's a question I've been looking at answering. And it did give me some inputs on how I can leverage my skill set into really making an impact to other people. Of course, scientific research in the long run does make an impact. All your medicines and diagnostics and all medicine pretty much, resides in discoveries made in basic research. And one has to be technically excellent. But other than that, what can be an immediate impact? So I could find an answer to that through, really making others excited about what the work that we are doing and providing our knowledge and skill set to others, helping uplift others. So science as a way of service to young students, to people, anyone who wants to benefit from it. So that is something, and the tools and the, how to do that, how to really do that. So, and also another thing was, as Madhura said, agency. So earlier I was a little hesitant in voicing my, ideas, always thinking I'll definitely be shot down. That was there, and I'm still shot down, but no, I no longer hesitate. And because of that, we have been able to, really push the development of cutting edge diagnostic services in AIIMS New Delhi in our department, which is now I am in charge of that. So we were able to push these things because I no longer was scared to do that. So that is a gift of the leadership journey for me.
Thank you so much, Pragyan. And these are such incredible testimonials, I think, for the work that WomenLift Health does, but also for the journeys that you all are going through. So I'm getting goosebumps as you all are talking, and hopefully I'm not the only one in the room. Mansharan, would you like to answer?
Yeah, so there are two words I'll use. But the first word that I want to say, which I think is a word which will stay for life, is just this peer group, and it's such a huge support and ecosystem for work. For we may not speak for long periods of time, but I think just to know that there's a very safe, supportive network of other women leaders. Where there's a work challenge or there's a conflict, and who do you really speak to? And it came at a time when I was really feeling that void, and to have that wonderful network, I know I can pick up the phone and ring any of those women, and if they can within their and so many answers that come from the group. So that's one. If you ask me, is something that I really cherish. The other piece that I want to say is really, I think I started looking at the word inequity in a different way. That's a word which sits at the core of my work actually, because we always talk about equitable access to contraceptives and equitable access to abortion care. But nonetheless, I think I've started to look at it in even more nuanced ways and to recognize it within the workplace and to kind of make sure that in a very intentional way, uh, to be able to take it to the next stage of women leaders in the team. And I think, and also to younger people, so I'll just say it was 3 days ago, there was this homework, and I'll just take 30 seconds to say this. My daughter is 11 and came home with this homework of saying, can you observe all around you anything that may be inequitable and any gender roles that you see? And, do you think it is fair? So, so I called the teacher and said, I love you for this. Because the journey, the dialogue starts much earlier. And it's great to see. But I think in the workplace setting, there was equity about programs which sat in at the core, but I think equity when it comes to leadership, and I would say all leadership, but then within that specifically also all the young women leaders. That's something that I hold very dear.
Thank you. Thanks so much, Mansharan, and thank you for focusing back on just, I guess, the effect that having a peer group has for women in the mid to senior level positions, where they go through specific kind of challenges and get elbowed out for some reason. And so what does it mean to have this community as our backbone? And so thank you, all three of you. I'm going to close the panel at this point and open it up to questions that anybody has in the audience. We've tried to incorporate some of these questions, I think, as the panel went on. But if you have any specific questions, you can raise a hand and we can unmute you and you can ask, or you can just type in the question in the chat and we will be very happy to answer. Malvika Mutkar, can we help her unmute, please?
Hello, am I audible?
Yes, we can hear you.
Hi. Thank you for organizing this. It's really lovely to hear all of you talk. I don't want to take too much time on really complimenting you, but what I would ask you is, and probably Mansharan would be more apt at taking this, but also others. When we're talking about public health, and when we're trying to take issues such as not just SRH, but also something like an adolescent pregnancy or menstrual health, and when we're trying to implement them in rural parts of, say, places like Rajasthan, for instance, that's where I work. I work at the Chambal Ghats. I run my own foundation. And I think it's the cultural nuances of being a woman yourself and doing such groundbreaking work, and B, trying to influence the other women there where, you may not have such a high receptivity. So I think the question here is more in terms of A, one is the technicality of the work, but B, how do you really manage the cultural nuances of yourself fitting in that system, and then ensuring that your program is able to, really go through and penetrate to the kind of women who don't relate with conversations such as agency and equity, and economic independence is something that is really unheard for them.
Yeah, so I can take a shot at this. I mean, I think there's no easy one-word answer or a quick fix solution to this, and we can have a much larger, longer conversation about specific programming styles. But yes, it's been often to find the right kind of voice in the community from where those messages will get received in the way that and form and manner that we may want them to be, and really anchoring sometimes the conversation in what is the ultimate, in a form and manner that is accepted. So of course, I think anything, particularly conversations around equity and gender, have to lie within a social construct, and it cannot be devoid of that. But it's a long road. Yeah, it's not easy, and it's not one day. I mean, these are things or changes which may take years, if not decades.
Go ahead, Prachi.
Yes. To actually, Malvika, I wanted to make a plug here. We are going to be doing some regional workshops, Malvika, virtually, where we are inviting alumni who are regionally located in different spaces to look at the different work that happens and how the cultural, social norms impact public health. Rajasthan is one of the areas. We'll be launching that on 3rd. So watch out for that. And we'll have people who work in Rajasthan maybe address and give a wing to the question that you've asked.
Thanks, Prachi. Thanks a lot for that. I think Anuradha had raised her hand, and I don't know if she still has a question, but I'll just give her a moment to.
Yeah, hi. Am I audible?
Yes.
Yeah, hi. So I have so many questions, but I am not going to kind of bombard them on this lovely discussion that we've had. A lot of learnings, but I am very, very curious, and I'm also very confused because this leadership project has got me a little confused, despite the fact that as a journalist, I've been doing so many of these kind of stories, bringing voices, people's voices, etc. So, a leadership project, somehow somewhere it's getting into my head that it's a research, it's a thesis, you have to do some PhD, and I'm going a little berserk thinking kya dale isme. So sorry about that, but yes, what I understood is what I'm sorry, I don't remember the name, but somebody said that science is a service to society. And I just loved that, because I just think this kind of service that the Women's Lift Up Health program is doing is amazing. So probably I'll just dig deep into my soul and come back with some project. Thanks, guys. Thanks a lot.
Thanks, Anuradha. I don't know if any of the panelists want to respond for a minute.
Sure. Thanks, Anuradha, for being inspired with my statement. But the original inspiration was Oprah. She actually said that the way that she became a phenomenon is by doing whatever work that she was doing as a service. So as a TV show host as a service to society. So then I thought, why not use, then I can also adopt that philosophy and see how I can put science to society, to the good of society. And the same, I think the philosophy for all of us here in the WomenLift Health cohort, even the program managers, is to somehow serve someone else, right? Even the WomenLift Health program uplifts other women as leaders. So I think if that is the crux of your project, and that kind of serves the purpose.
Thanks, Pragyan. And the only other thing that I would add to that is that consider your application as your first kind of putting on paper your first thought, right? And then you have an entire year where you're going to have your peers to talk to, a lot of feedback that you get from your mentors, your coaches, and the leadership project often evolves. What ends up happening towards the end of the project is actually nothing that you wrote in your application. So all of this to say is that if you can keep your inhibitions away, put that thought on paper, put the idea on the paper, and you'll get the support required through the journey to be able to take it to some kind of completion. So thanks for that, Anuradha. We have a couple of more folks asking. Rachna, can we unmute Rachna Tripathi, please? Go ahead, Rachna. I think you're unmuted.
Yeah, can you hear me?
Yes, we can.
Yeah. So basically, I work in development and manufacturing. So I'm founder of a company which is involved in developing the diagnostic tests and manufacturing them for the different diseases. Involves like tuberculosis or hepatitis, or a better example, like we were manufacturers of COVID kits, RT-PCR. So my company is HUWELL. So as do you think that I am a good fit for this kind of training course?
Yes, absolutely, Rachna. I think if you're somebody who works in the area of public health, which it seems like you do, by all means, you can go through the website and see read a little bit more about the criteria, but I think based on what you're saying, absolutely. And if you're somebody who you think is at the cusp in their leadership journey where you would benefit from all the things that the alumni have spoken about, please go ahead and apply. Yes. Thank you, Rachna. And if I can ask Monica Giri's, can we unmute her, please?
Hi, can you hear me?
Yes, we can.
Yeah, so this is a program where it is about women health, and I'm a self-employed and I have my own clinic. I'm a dentist, and this program is more of like the projects needs to be more of women health. So this program where I'm stuck into one single part of this surrounding my clinic, and that's it. So how could the projects be of my choice? Would be more like how can I choose my projects of for women health?
Yeah, I mean, I think from our perspective, Monica, as long as your project is at the intersection of public health and gender, you should be able to apply and kind of put down any kind of ideas that you're having. Like we said about the leadership project, I think it can be in the area of your influence, but let it also try and touch on or rather be a stretch goal for you, right? So take this as an opportunity to think about a problem that you've been thinking about in your area of work, and try to explore that a little bit through your leadership project. And like I said, I think the application is only a start to your leadership project. You'll get multiple chances to kind of evolve it, but I think by all means you can, even in your area of work, you should be able to put down a passion idea or a problem that you've been thinking about that you want to just kind of explore a little bit more. You should go ahead and do that.
Okay.
Thanks, Monica. We are running a little bit out of time, so I'm going to hand over to Prachi, who's going to help us close this and just give you a couple of glimpses into what the application kind of criteria will look like. And then we can close it out. Prachi, over to you.
Yes, thank you so much. Yes, Tintu, you have one more question, you say. So yes. Yes,
Can you hear me?
Yes.
Yes, we can hear you.
Yeah. So quickly, I'll just ask my question. So I am a lab scientist who also works on the field, and a few of the burning questions, especially I could resonate with what Madhura said, that we work a lot on the bench space, but when it comes to panels and representing publicly on a platform, how many of the women are there on a public platform? So that is something which I was thinking to work on. And second thing that I was having in my mind is developing an app on tracking the mood changes with the menstrual cycle, because very often, especially if it's a lady boss or a lady team member who respond in a way, or when they start drawing their boundaries, it's often projected onto their menstrual cycle or a mood change, which, I was just thinking about. So do you have any suggestions or, inputs to what I've been thinking? Because it's lab scientist, so I'm really confused on, and I really want to do what I'm proposing, not just to put that on a paper for the selection process, but I really want to make a change, at least in the niche that I'm working on, so that I was passionate about. Yeah, thank you. Over.
Madhura, would you like to take that?
Yeah, I mean, personally, if you want my personal opinion, I like the first one. The project that you proposed. How many people are out there on public platform? There are many who are working at the bench, but how many actually have the courage to go out, speak, and project themselves and represent themselves, right? That would benefit larger community actually and help them open up also. Mood changes. I have actually used a couple of apps few years ago to track moods along with the periods, but that's my personal, very much tracking going on. I personally don't think we should worry about what people think about our moods. I'm sorry to put it out there. So I don't know how much that is going to help from my point of view.
Yeah. Thank you, Madhura. I think that's good input for me. I'll work on what you suggested.
Yeah, I'm glad it helps.
Thank you.
All
Thanks,
right,
Madhura. Go ahead, Prachi.
Yes, last 2 minutes. I'm going to take that in. Thank you, everyone, for attending, making it very interactive, especially to the panelists. We've also posted the link to the application and an email address, which you can all reach out to if you have any questions where we can answer as a team. The deadline for this is 25th of October, so not a lot of time left. We, of course, had a lot of conversation about the leadership project, and I have just posted a link on the chat where there is a detailed document of the leadership project. So the themes that are there, the criteria for the leadership project, how can you form it? How do you get help during the cycle of the leadership journey? All of that is there in that PDF. So it's a great document for any questions on that. If you go on our website, you'll also find an FAQ section. So all the questions that have not been answered right now, there are going to be very few, can also be looked on that. Apart from that, we wanted to plug in a few tips about the strong application, and everything that the panelists said are of course valid. But if you want to focus on the leadership projects, make it innovative, but make it feasible. There's a timeline that we work with. We do not say that the leadership projects need to be finished by the leadership journey, because that's impossible, but there's also some kind of feasibility that comes on it. Make sure there's some kind of inclusivity angle in it. So highlight how your project will involve diverse perspectives and communities. Emphasize on the strategies that are going to be inclusive. Highlight the impact that's going to come in. We should also, and we've discussed this many times, it's not about specific research or making it about women's health, but having a gender lens or having a project at the intersection of health and gender is crucial. And that is something that we look out for. But leadership project, like I think Pragyan was mentioning, it seems like for the sake of this conversation is a large part, but there's also a large part about leadership and yourself, which is we'd like to believe a very reflective section for everybody. And for that, just go on to share your story, discuss the challenges that you're facing, discuss the challenges you faced as a woman, as a mid-career leader. And if there are members of marginalized community, and if you think there are women who should be applying from not just Delhi, Mumbai, Bangalore, but states, we are absolutely looking for diversity and unique perspectives. So feel free to share what is the unique things that you bring in. And if there is intentionality about the development that you're seeking, that is also something that adds to the application. On the recommendation, since there was a question, it doesn't have to be from your immediate supervisor, but someone who is familiar with your work and is senior to you and knows you in a professional capacity, and that should be all. But at the end, like Pragyan said, the one and only final thought for this is be authentic and bring to the table what you actually want to say and do. And I think we hear that and we see it when we read it. We can almost hear people speaking, but that's our last word. And the email address is in the chat. If you have any questions, do reach out to us.
Thank you. Thanks so much. And thank you to our panelists, Mansharan, Madhura, Pragyan. It was a pleasure talking to you this afternoon. And thanks everybody for taking out the time to listen to us and our stories. It means a lot. Thank you.
Thank you. Thank you for inviting.
Bye-bye.